So today we're talking about a topic that is near and dear to my heart. It's really about lab work and why do tests like Lyme disease or things like Strep or things like Epstein-Barr, why are they often negative? What happens? Why are they missed? Why are they misread? We are here with Dr. Bill Rawls. He's a physician who specializes in chronic illnesses and Lyme disease. And it's really a pleasure and a privilege to have you here, Dr. Bill.
Roseann.
Yeah. You're such a gifted practitioner and also a lovely human being.
I think about things a lot.
Yeah, I know, right? I draw we're in our own thoughts. And then we are very nerdy in research and science, which is, what makes you a great practitioner. Dr. Rawls, when so many people come to me and, they'll say things like my kid or I have all the signs of Lyme disease, but the test came back negative. Why does that happen so often?
Yeah, I think it's because Lyme disease is really, we're going on down a rabbit hole here. Lyme disease is just not what everybody thinks it is. And when you get to my understanding of chronic Lyme disease, not only do you understand that, you really understand all of chronic illness. So yeah, that's a big factor. Our expectations for the testing surpass what the testing is capable of doing. And it's really just, you have to understand testing to understand that and understand why it's not always valuable.
Yeah. And so many people think, talk about a clinical diagnosis of Lyme disease because they think there is a test that
Right.
absolutely definitively diagnoses you. And the answer to that is
No,
there isn't.
no, not at all.
Yeah.
Yeah. For microbe testing, you have to understand, and this is a differentiation that the conventional medical system and everybody really doesn't get. And that is there's a very big difference between acute illness, an acute infection, and someone who is chronically ill. So I don't even use the word chronic infection with chronic Lyme disease. So what an infection is when a microbe first enters your body, right? We have barriers to keep microbes out, our skin, our mucous membranes, all these linings, and microbes want to get in our body because we're basically food and resources for them, right? They need that. Everything needs something. Everything living is food for something else. So they want to get in our body because they need those resources to survive, to reproduce, and to spread to other hosts. So an infection is when that thing, whether it's a respiratory infection, a tick-borne microbe, whatever, that's when it first enters the body. And when that happens, the levels of the microbe, whether it's a virus, bacteria, protozoa, yeast, are going to be very high. And the immune reaction is going to be very intense for the first several weeks to months after that happens. That's what testing is built for. It's as simple as that. And so if you have an acute infection, you're much more likely to have a positive test than what happens when an illness becomes chronic. And it's learning the difference between those two.
Yeah. And I think people don't realize with tick-borne infection, first of all, there are many infections that are hundreds, right, that it can carry, but also they don't really understand the difference between that early stage, which is that can fall into acute, and please correct me because you're the expert on this, and chronic and how it gets missed. And I think people are surprised because they think we'll get into the symptoms. I think they think, well, I got bitten by a tick, right? And just quick little facts about, ticks. One, they don't have to be on you for 24 hours to transmit. One bite can cause a lot of heartache. And so I think they don't realize that you don't have to have the high fever. You don't have to have the joint ache. You don't have to have a bullseye rash. And you can still have tick-borne illness, but it takes some time to show up for the majority of people. It doesn't always show up in such an acute manner. Is that correct?
Right. Yeah. And it has to do with the difference in different microbes and what their strategy is, right? So some microbes have a break down the door and get all they can get right from the beginning approach. So these are the microbes that make us sick. And they're actually much less common than the ones that we're exposed to more commonly that don't make us very sick or often don't cause symptoms at all. So when you look at all the tick-borne microbes, that's not their strategy. Breaking down the door and making you deathly sick is not what they want to do. What they want to do is have a presence in your body. And so they're very stealthy. We call them stealth microbes for a reason, or stealth pathogens. So they enter the body as easily and quickly as they can. Tick bites are great because it injects them right through that barrier that's keeping them from getting into the body. They enter the bloodstream, and the immune system recognizes these things and is on it immediately. But the microbes are trying to course the bacteria, the pathogens, whether we're talking about spirochetes, Borrelia, or Bartonella, or much of anything else. They're trying to transit that bloodstream as quickly as they can, get to tissues. And here's something that I've learned over the past decade that is really the key to understanding why we become chronically ill is that they don't, they're trying to bypass the immune system, and they've developed some really sophisticated ways of doing that over the hundreds of thousands of years we've been exposed to these things. So they bypass the immune system's defenses. They invade cells throughout the body, in our brain, in our heart, in our joints. Different microbes invade different cells. That's why different people have different symptoms, because it's never one thing, it's always many things. They invade cells, and if we're healthy, then they can just go dormant and they can stay there for a very long period of time. So that's happening with tick-borne microbes, but it's happening with some respiratory things like Epstein-Barr and Mycoplasma pneumoniae and Chlamydia pneumoniae. And it's happening with Bartonellas that we get exposed to from cats or dog bites or, possibly hamster bites, So we're picking up things all through life that can bypass our immune system without us hardly even knowing it and go dormant and stay there. And it's like a reservoir that you have in your tissues. And we're just starting to understand and recognize this, but the evidence that's being accumulated that this is happening and that this exists is way too much to ignore.
So much to unpack there, Dr. Bill. I mean, because I think that people don't really, this is why we're having this conversation. I think it's surprising to people that these bacteria and these viruses, they're so stealthy. And so the stealthness means two things. One, what we started this conversation, that testing doesn't always show things. And that's
Right.
partly because of the way the bacteria and these invaders work, right? Is that correct?
Yeah, I've had this theory. We can't prove it, but if we could get into the bodies of every person that lived in New England and look inside their cells, which we just don't have the capabilities of doing. We can't chop people up and look inside their cells, right? But if we did that to everybody in New England, I would not be surprised if we found that virtually everyone was carrying some tick-borne microbes within their system, within their cells. Yeah.
Yeah. I would have to agree with you, because I think what happens to people, and I see this quite a bit, is like you're talking about a healthy person where these microbes are living there. And so they're not feeling the effect. And there have been research studies. There was a study that was done in Bologna, Italy, where they looked at healthy children, at school-age children, and about 25% of them had tick-borne illness in their cells, which was, I always like to talk about, because I think people don't realize you can be walking around healthy. So they're living in balance, and you often see these tick-borne illnesses, microbes come up when you have other stressors, COVID, you actually get pneumonia, you have head injury. I'm sure the list goes on.
Yeah, those are some big examples right there. For me, I probably picked all of these microbes up that made me sick when I was a kid. I played in the woods. I got tick bites all the time. I was constantly getting scraped and cut and hurt and things biting me. And I picked up a lot of stuff. But it wasn't until I had been taking obstetrics call every second to third night and not sleeping for 20 years that my body gradually started breaking down. So what it's about is cellular stress. When your body is stressed, your cells are stressed. The cells containing the microbes are stressed, and these microbes start reactivating. And when they do, they start breaking, they merge from the cell that they come from, they destroy that cell, and then they start invading other cells. Well, at the same time, the body looks at this and the immune system looks and goes, oh my, there are all these microbes emerging from these cells, and it starts attacking the cells, which actually makes it worse, which is a pretty plausible explanation for what autoimmunity is. But this thing so we're finding evidence of this in chronic Lyme disease, but also Parkinson's, dementia. Virtually every disease I look at, I find evidence of this microbe dormancy with reactivation, cellular stress, same thing over and over again. Different microbes, but the same basic scenario. And I think it's really important to pay attention. But, once something is dormant in your system and then reactivated, you have the same level of microbes and you don't have the same kind of immune reaction. So it's not going to necessarily turn that test positive, even though it's there and it's active.
Yeah. So for people that this is new to them and I meet so many families that I work with where they've just poured so much money into testing. I mean, I stopped personally, and my son has PANS from chronic Lyme disease and he's doing great, but I stopped counting after $50,000 worth of testing because
Right.
at a certain point I said, what's the point?
Yeah.
When we were doing our best was when the testing was actually its worst, because the way certain tick-borne illnesses, it takes a long time for it to actually show up in your testing. So for people that are hung up or believe or working with practitioners that are like, you need this testing, we're not saying no testing. We're saying testing has its value at a certain point. What should they do when they know something's wrong with themselves? They know something's wrong with their child and the testing is still false. What should they do?
That in itself is a complex question because
Sure.
I think there's so much misinformation out there, even among providers, that there are a lot of traps that people can actually fall into something that they're just going to pour money into. When you look at testing, there are two main reasons to test for chronic conditions. One, it seems to be a passport. You can't get into certain offices or get certain things. It's a verification to say, I have this identity. So that's one thing. The other thing is just from an academic point of view, the more we know, the better we are. So forwarding information, but it's more academic. It's not, but here's the deal. Most testing for people that actually have a goal of getting well, most testing has virtually no value because testing is good for acute infections. Once again, if you develop an acute pneumonia and there is a bacteria attacking your tissues, those are very fast growing bacteria. They're doubling their growth rate every 20 minutes, which means somebody can get really sick really fast. And you do want the right antibiotic to treat that. Antibiotics work for things that grow very fast. So that's the right answer. You need a test for that, even though even that testing isn't as good as you might think,
Mm-hmm.
because it's often not just one thing that's invading your lungs. So even then, it's kind of suspect. But so this idea of test and treat works for some things with acute illness, but it's really not a very good model for how to make people well. When you get outside of that and start looking at these stealth microbes, I just said, pneumococcal pneumonia, the bacteria that causes that, turns over every 20 minutes, doubles itself every 20 minutes. Borrelia, the Lyme bacteria, in its most active state, turns over every 12 to 24 hours. And the same is true for Bartonella and Babesia and all of this. So I'm seeing these doctors using more anti-malaria drugs, these really potent drugs, because people are found to have Babesia. And it's like, okay, here's the problem, that it's malaria. It has explosive growth. So the drugs work better. When you look at Babesia, it's really slow growing. So slow growth is a defense mechanism. Intracellular, invading cells, going dormant, reactivating in different ways, having very slow growth. Those are all defense mechanisms that allow the microbe to persist in your body. And you can persist and not necessarily be unhealthy. What happens is other factors come together. People, and we've got a lot of those. People are eating bad food.
Mm-hmm.
They're not sleeping. They're exposed to a range of toxic substances that humans have never been exposed to before. They're not exercising. So they have poor cellular health, and that is an opportunity for all these microbes to start reactivating. And so it's never one thing, it's a lot of things. So when we look at testing, the value isn't as much as you think it was.
Dr. Bill, I hadn't really even thought about testing as an entry point into a practitioner. It's true that sometimes they need to do that. What are your thoughts about, so standard tests like the Western blot, obviously now we're understanding this. It's acute, right? You have acute symptoms, get tested. Something is going on. But, I spent all that money. These were on tests that weren't through insurance. And I'm not saying there wasn't some value, but at a certain point, I stopped 10 years ago doing any testing. I just did. It just wasn't important anymore. We're in a chronic state. What are your thoughts about some of these really expensive tests?
So what's the difference between fibromyalgia and chronic Lyme disease? Because they basically have the same symptoms. What's the difference?
I don't know. You're going to tell us.
One person found some way to get a positive test for the Lyme bacteria and the other one didn't. That's about the only difference. But I think they're both microbial. In fact, I'm thinking that most chronic illnesses are microbial. But that's a big deal, because if you have fibromyalgia and you go to your doctor, they're going to say, well, we don't really know anything about what causes it. We've got drugs that are highly habituating that can help your symptoms, but that's about all we have to offer you. And then people hear, well, my symptoms match chronic Lyme disease, and if I can find a positive test, then I can get antibiotics, get well, and I'll be great, because that has a cause. Fibromyalgia doesn't have a cause. And so it's a big deal to get a positive test, because people think, well, that's my ticket to getting well. But it's a myth. It's a myth. And there's value. I don't want to knock the testing labs too much, because I do think there is some value in testing. And I think the more
verification at a minimum,
but I think
it's important for us.
Yeah, I think it's important for people to know that people are desperate, and getting a positive test is a perception that they might have something that's treatable. The medical community doesn't recognize chronic Lyme disease. All these labs have exploded because if your insurance doesn't cover it, but you're desperate, you're willing to pay $500 or $1,000 or several $1,000s for testing. So it's enormously lucrative. Now, some of the labs are really good, and I think they're doing a good job. And as we get better testing, maybe in 20 years, we'll be able to do a blood test and know exactly which microbes are actually affecting people. The problem is testing should be limited to what is actually going to affect your management. You mentioned a while ago that Lyme disease, chronic Lyme disease, is a clinical diagnosis, and that's true. What that means is you look at the patient's history. They've got a certain presentation of symptoms. They've had tick bites. Possibly they got ill around the time of a tick bite, though I find most people with chronic Lyme disease don't remember getting sick around the time of a tick bite. So there's that association, and that's enough to define, yeah, this is probably a tick-borne illness. The margins blur between all of these things. A lot of people with chronic Lyme disease have neurological symptoms, right? I did. Symptoms of, am I developing multiple sclerosis? So they go to the doctor and it's like, well, multiple sclerosis is a clinical diagnosis, and you don't quite check all the boxes. So everybody thinks there's a test for multiple sclerosis. There isn't a test for any illness. They're all clinical diagnoses. Somebody puts together. So you could go to one doctor, one neurologist, and they say, yeah, you've got multiple sclerosis, and go to another one and they go, nah, not really. But we all have those symptoms. Well, if you dig into the literature, you find that Borrelia invades the cells that produce myelin, which is the thing that protects or insulates our nerves, along with chlamydia and other kinds of microbes. And I found evidence that Borrelia actually invades the oligodendrocytes, the cells that contain the myelin that insulates our nerves, and can go dormant and then reactivate. So you have that connection and you go, okay, well, why are not all those people have MS? And you find most people, a lot of people with MS test positive for Borrelia. What's the difference? And it's just the people that are more sick are defined as multiple sclerosis. So, the margins blur. So I don't even like the idea of diagnosis in chronic illness, because the problem with it is, in the conventional medical system, the concept of diagnosis, when we diagnose something, that defines the treatment. Well, for acute illnesses, that pneumococcal pneumonia or a broken leg or a blocked artery, you need to know exactly what the problem is so you can target the therapy to fix it. But in chronic illness, it's not one thing. It's everything in the body breaking down all at once. The concept of diagnosis changes. Instead of defining the problem, the cause, it defines the manifestations, the symptoms, the abnormal labs. All of those things go in to define the diagnosis, and that defines the medical therapy and medical therapies for chronic illness. Now, again, chronic Lyme disease is excluded from chronic illness in the conventional medical system because they don't have anything to treat it. But in all the other illnesses,
think, Bill,
right?
You know what I mean?
Yeah. So all the other illnesses, they're drugs that treat the manifestations. They block the symptoms, they block other things, but they're not getting to the root causes of the problem. So when you start thinking in root causes, when I sit down and spend an hour with a person and go through all the reasons why they got ill and understand the illness itself, the diagnosis becomes irrelevant.
I used to be do neuropsych testing, and so all I did was diagnosis. I think about diagnosis more as a bucket of understanding. Most people don't just have Lyme disease, by the way, as we're talking about microbes, right? They might have Epstein-Barr, they might have strep, they might have a whole host of things. Once the body breaks down, other things they activate or they come to the party, as I always like to say. When we understand the different microbes, it does inform us, and we hopefully are being educated as parents, as patients, to be the CEO of our own treatment. Obviously, we have to align ourselves with practitioners who have this idea of root cause treatment, which is not the way our traditional American medical system is set up. It is set up to address symptoms in isolation.
Yeah.
Without connecting the dots.
Yeah. When it comes to chronic illness, I think this is important. When it comes to chronic illness, which excludes chronic Lyme disease, there are no drugs that actually address root causes. They misinterpret what a root cause is. I think this is really important. So you hear a lot of times that, hormone imbalances are root causes. Inflammation is a root cause. It's not. Those are all part of the processes of the illness. So root causes, the only things that can be defined as root causes are things that directly harm the cells of our body. So our body is made of cells. Everything that happens in our body is due to the actions of cells. Symptoms, all symptoms are a reflection of cellular stress or injury. When you look at root causes, it is things that damage our cells. And there are only 5 categories of things that are the root causes of every single illness out there.
Well, let's get into it, Bill. Let's talk about the 5 root causes, because I think this is going to be surprising for people because, there is a lot of misinformation out in the world, which is why we're having this conversation.
Yeah. We think about the body as a whole. And we think of it as made up of parts. We have an organ. Our heart is a part. Our liver is a part. Our thyroid gland is a part. But all of those things, those aren't the smallest functional units in the body. The smallest functional units are living cells. Our heart isn't a unit. It's a composite made up of billions of individual units called cells that are working together. Everything in the body is cellular. And every aspect of illness can be traced to cellular functions or dysfunction. So when you look at the body as a whole, made up of cells, you start really talking about things very differently. Every cell in our body came from one cell. We started that way. And when we were born, when we were in our mother's womb, all those cells, that one cell was diversifying to all the different types of cells. We have over 200 different types of cells that make our body work. But every one of them are related to that first cell and are structurally similar. So they're like little microscopic machines that have jobs. So your thyroid cells have the job of producing thyroid hormone. Your brain cells have the job of transmitting impulses. Your heart cells or muscle cells have the job of making things work in your body. So every cell has a job. Every cell is structurally similar. Every cell is an independently functioning unit. So if you look at this as like a mechanical device, a biological mechanical device, every mechanical device has operating requirements. So every cell, number one, it needs the right nutrients to work. It needs carbohydrates and fats and amino acids to build protein. So it has to generate energy. It has to replace its parts. So it's continually replacing parts. It has to rebuild itself when it needs to. It has to have nutrients to do its job, like thyroid cells have to have iodine. If you're eating a widely diverse diet, you're going to get everything that all your cells need. You're eating a modern processed food diet, and your cells have a deficit, and they're not going to work right. So that's number one, nutritional stress.
And also, let me just say this, Bill, that 70% of kids are primarily eating processed foods. I'm just saying that. That's according to the MAHA report, which is based on research.
So they're getting overloaded with carbohydrate and fat, and they're getting protein, but they're not getting all the nutrients. And too much carbohydrate or fat is really bad for your cells because our cells are designed to run lean. Where actually, I think about it like if you take an old-timey steam locomotive and put it on the tracks and stoke the engine with coal. You're dumping coal in there, more and more and more fuel, but you keep the brakes on. Sooner or later, that engine is going to blow. That's what's happening. That's what we're doing to our cells. That's a big deal. And so nutritional stress is a big one. Second on the list is toxic stress. And when you look at our use of petroleum and coal, we've been dumping chemicals into the environment that are organic chemicals, but they're foreign. So if you went back and ate the plant matter that coal became several million years ago, it'd be good for you. Same with the algae that created petroleum. It'd be good for you. But all the years, millions of years of pressure in the earth has distorted those organic chemicals in such a way that they're incompatible with life. Everybody knows what happens if you drink gasoline. You're not going to live very long. So these chemicals, though, get in our body very, very easily because they're organic chemicals, but they've been distorted. And what they do is they clog up our cells and they block cellular function. So it's like putting a ball and chain on your cells. And we're all getting that to some degree or another. So that's a factor. And artificial radiation, EMFs, things like that, they affect how our cells work. We're not adjusted to them. Third thing is mental stress and poor sleep. Our cells need downtime to recover. And if we're amped up with a fight or flight response, it puts our cells on high alert so they don't take the time to recover. And if we're not getting sleep, it's like most Americans, average sleep is 6.5 hours. And if you're only doing 6.5 hours sleep, your cells by the next morning haven't recovered fully from the day before. And that becomes cumulative over time. So our cells need downtime. So mental stress, chronic mental stress is a big one.
And
Stress.
chronic mental stress is the norm. We've accepted high levels of
Yeah.
stress. And people don't realize that it's our body that determines it. We don't determine what's stressful. To me, I mean, nutrition is a big part of this too, but to me, compounded stress is the greatest threat to our physical and mental health. And we're not talking enough about it.
Yep. It's a big deal. Fourth on the list is physical stress, and you can put trauma, to excessive heat, excessive cold, but being sedentary is the biggest problem as far as the physical stress, because we need good blood flow to flush the junk from around the spaces of our cells. So our cells are compacted really tightly together, and the space between the cells is where fluid from the blood goes that brings oxygen and nutrients to the cell, but also flushes away toxic substances and metabolic waste that the cells are trying to purge. So those spaces become congested. They need to be flushed regularly so basically our cells can breathe. And if you're sedentary, that's not happening.
No.
So,
and they estimate 40% of American adults are sedentary. What's the minimum exercise amount? I have read that it's 22 minutes of exercise to counter a day of being sedentary. I don't know if you know that answer, certain amount of steps or, because a lot of people here are chronically ill. We wind up making like chair yoga routines for people, like meeting people where you're at. But what's the minimum amount that people need to exercise to support cellular health?
Yeah, I've never seen an absolute minimum. When I look at things, it's like, how did humans exist for hundreds of thousands of years? For most of time that humans have been on the earth, they were foraging. And so they weren't doing big, heavy lifting. They were basically picking things up, digging roots, stuff like that all day long. And so it was low, moderate intensity exercise throughout the day. It's hard for us to do. Me personally, I try to walk at least 3 miles a day. I go to several yoga classes a week. I do, some weightlifting, but, lighter weights at home. So I'm constantly moving. My wife, she's constantly doing little projects in the yard. I mean, she's just never sits down. She's always active. But it is hard when you're chronically ill. You just don't feel like moving. And it's because your tissues are so inflamed, but it is so critical to the recovery process. So what you're talking about, chair yoga, qigong, and for people who can just walk, if you can just walk. I talked about that I walked my way back to health, and there was a point where I couldn't walk a half a mile.
Yeah.
I mean, it was pretty bad.
I have people I do this myself because I'm writing all the time. I'm doing 2 to 5 minute spurts, like multiple times during the day. It's dramatic how differently you feel.
It is. Yeah. And that's my biggest stress now. Same as you. I spend so much time on a computer creating content to help people that I have to be really careful that it's not making me sick. And it's like when we finish this podcast, I'm going to go get my dog and go for a walk. So I try to break it up through the day to do as much as I can. I'll stop and do a 10-minute yoga routine. I mean, it's just so important. Or just get up and do some housework, I mean, that's that in itself. Just puttering around. Any movement you do is increasing your heart rate, flushing your cellular spaces, flushing all of that waste into the lymphatic system, which for the lymphatics to work, you have to move. It's muscles that move the lymphatic system and cause it to flush. So movement is really important.
I appreciate this conversation so much because I think so many people think they need to do 40 minutes or half an hour. It's great if you can do that, but I'm encouraging people to, think about, 2 to 10 minute little spurts, and it will add up to the same in the end. And in fact, I think it actually makes you feel better, encourages, just continual movement throughout the day instead of being sedentary. I think it's incredible that you walked yourself back to health.
It's not about bulking up. It's about just moving. So that's number 4. And number 5, we've already talked about. It's the microbes. And the fact of the matter is, we're an ecosystem. We live with a lot of different microbes, and not all of them are friendly. We've got a lot of things in our system that are constantly looking for an opportunity. But when we talk about these cell stealth microbes, they're opportunists. We all have them. It's not just in our gut, it's in our tissues. More and more evidence is accumulating that's verifying this. And they're just waiting for an opportunity. They're there, they're hanging out. And it's when you eat bad food and don't sleep and all these things that these things start reactivating. And I'm starting to find some early evidence that this is happening with even any symptom, even transient symptoms, like you go work out too much and your muscles get really badly sore, you've probably got some microbe reactivation going on too. These are big factors. And that's basically, in a nutshell, the causes of all illness. Now, we've done kind of the 5-minute version here, but you can go pretty deep in those 5 categories, but it doesn't matter what we're talking about.
In terms of what illness it is, these are the root causes of people. I don't think people think about cellular health. They think, I have something that must be killed.
Right.
And so much of what happens for me in the PANDAS, Lyme world, it's like, I'm going to do this. I'm going to get IVIG. I'm going to do, even ourselves. We did, 20 years ago, my son got sick. We did 3 rounds, 2 years at a clip of antibiotics each time, 6 years on antibiotics. That didn't work for us. It worked at the time. It kept us in place. When people are listening to Dr. Rawls and they're starting to rethink, maybe they're putting the pieces together and saying, wow, I wax and wane. Every time I work out, I feel super sick. The doctor says, oh, I have this, or I don't know. Where do you recommend people start? I mean, that's a whole other episode, but like even at one point they're unsure, they've looked for help. Where do they start?
Well, I mean, that's a big part of what I do is try to guide people. I've written books. My most recent book, The Cellular Wellness Solution, is really a big guide to that. I create programs for people to follow that are curated to take them through these steps, to teach them all the things that they need to do. Because when you look at wellness, what wellness is how you get there is restoring cellular health and making peace with your microbes, not necessarily trying to eradicate every pathogen in your body. And so finding that pathway is so remarkably important for people. Wellness doesn't come out of a doctor's office. There are a lot of things that you need a doctor for. And it's mostly, where our medical system shines is acute intervention. And that's why we all need insurance. But if you want to overcome chronic illness, there's certain things that you'll need, but most of it comes outside the doctor's office. And it's things that you do. And the more proactive you are, the more you learn about this, the more you learn about a pathway of restorative health, of creating an environment that restores cellular health and puts microbes back in the box. That's where you're going to get longevity. My health, I was broken by age 50. I was an old man. I'm 68 now, and I'm having some of my best years. And so that's a big part of it. So on top of the lifestyle things, though, herbal medicine is what I found that gave me an edge that nothing else was able to do.
So probably going after something like it's acute, do you feel like that's probably the greatest mistakes that parents or patients make when trying to get treatment for Lyme disease or microbes? Where do you feel like is where most people who land on your doorstep, where their greatest barrier or their issue is in getting better?
I think it is a misconception across the board in so many areas. Functional medicine was probably headed in the right direction, but it's gotten so complex with testing this and treating that. It costs people a fortune, and it's kind of crazy.
Yeah.
It's about that restorative pathway that's so important, and it applies to any illness. I mean, you mentioned PANDAS.
Yeah.
I found evidence that, it's linked to streptococcus, right? Kids get a streptococcal infection, they get treated with antibiotics, and they start developing all kinds of behavioral manifestations and other complications. And then repeated antibiotic therapy sometimes can make them worse and often doesn't make them better, right? I actually found evidence that group B strep associate the type of strep that's associated with PANDAS. This is something we didn't know, but streptococcus can invade cells and go dormant for long periods of time, reactivate. And also something that Borrelia and all its compadres use is something called a Trojan horse mechanism to get in the brain. They invade white blood cells, go dormant. They use that as a transport vehicle that gets them across the blood-brain barrier, and then they deposit in the brain. Found out that streptococcus can use that Trojan horse mechanism to get in the brain in kids. But often what you find in kids is there are other factors. They've got other stress factors going on in their environment or their lifestyle or whatever that precipitates this. So they've got the strep, it's gone dormant, and they have these other stress factors going on. It reactivates, and it comes and goes and causes all these weird symptoms. And antibiotics, when you look at treating chronic things with antibiotics, it's a real problem because these are slow growing. They slow their growth down. They're intracellular. They reactivate intermittently. So antibiotics aren't working because it takes so long to get rid of them. And all it takes with an antibiotic is within 10 days, you start disrupting your gut flora. Within 10 days, you start generating antibiotic resistant pathogens that can be even worse than the things you're trying to get rid of in the body. And it's destructive to cells and mitochondria. Antibiotic resistant pathogens.
I don't think people think about, we're so overprescribing, overusing. I mean, the amount of work we had to do to repair our son Max's gut from that antibiotics. And, this was a different time of Lyme disease. It was 20 years ago. I don't want to say it was that different because I think it still goes on today, these things. But herbals, changed everything for us. And certainly in my own work of regulating the nervous system, I do a lot of things with cellular health too. And, I think what's hard for people when these symptoms wax and wane, I think one of the biggest conversations, the important part that is coming out of this conversation, and I don't want people to feel hopeless. I want them to feel hopeful, is that these things may live within us and they were always there before. And so the takeaway are those root causes, and how do you bring lifestyle factors for balance? Like as Dr. Bill Rawls was saying in his own life, you were broken. 18 years ago, you were in way worse health. You're actually in great health today because of the adjustment of your lifestyle. Is that correct?
Well, that and taking herbs for 20 years really has made a difference. But how many people die of chronic Lyme disease and PANDAS every year? Not complications that come later. How many people die of those conditions every year?
I don't know the answer to that.
Not very many, right?
Yeah, right.
Okay. Antibiotic-resistant pathogens kill 1 million people every single year, and that's been happening since the 90s. We have not made any new antibiotics since I was graduated from medical school in 1985, and pathogens are resistant to all of them. Short-term antibiotics, they can be lifesavers. And that acute pneumonia, it's really important. But when you start using antibiotics for 3 months or 6 months, you are actually not only putting yourself at grave risk, you're also contributing to a worldwide problem that has become horrific. So it's something we should pay attention to. All herbs have antimicrobial properties, and some are quite good antimicrobials. That's been well documented in the scientific evidence. That the interesting thing about the herb is, instead of a single chemical like an antibiotic, you're talking about the plant's entire defense system. And there's an intelligence about it. Herbs don't disrupt your gut flora. They kill pathogens in the gut, but not your normal flora. Herbs don't generate antibiotic-resistant pathogens. And herbs actually protect your cells in mitochondria, not damage your cells in mitochondria. So that means that you can use them for years. I've been taking herbs for 20 years, and I've experienced some of the best health in my entire life over the past decade. So it's a really important message.
Yeah. I mean, I've been taking herbs since the early 90s. I am somebody who has Epstein-Barr and has to just make sure that I manage it and keep it in check, and the things I do work.
Of the world's population carries Epstein-Barr.
Yeah.
We all have it.
And not everybody activates with it, right? But
Right.
It would show up when I didn't want it to show up. And then I had to, change my lifestyle. Gluten and dairy don't agree with me. That was a huge shift for me in a lot of health. Everyone's unique. Everyone's unique, but we know certain things. I have to keep my inflammation low, and I have to really work on things to improve my detoxification because I'm a poor detoxifier. I do those things, moderate my stress. I am living my best life, of course, and also trying to sleep.
Yeah, it gets back to those 5 factors. Are you eating a decent diet? Are you going out of your way to get sleep? Are you cleaning up your environment? Are you moving enough? Because the first step in detoxification is increasing blood flow and flushing those spaces around your cells. And are you protecting yourself from these stealth microbes? And the best way to do that is by taking herbs every day. So whether you're recovering from a chronic illness like chronic Lyme, or you're frustrating with something that they don't know, you hear, we don't know what it all is all about, like chronic fatigue or fibromyalgia or autoimmune illness, it's all the same stuff, different spread of microbes. You mentioned Epstein-Barr, right? So we know to test for Epstein-Barr. So that's how you identify your illness, is with Epstein-Barr. There are other things there that we're not testing for that are also reactivating. So whatever people think they have, whatever they've tested for, multiply it by a factor of 100, and you might be getting a rough estimate of what's going on in your system. Back where we started, that's a limitation of testing. It's great for acute illnesses or acute infections. It's not as good for chronic illnesses. All chronic illnesses are associated with microbe reactivation. There's a lot of stuff that we don't know out there. I mean, every time I pick up new literature, I learn something about new things out there that they've newly discovered. Well, they just discovered them, but they've been around for a couple of 100,000 years. But our environment has changed. Our food has changed. The way we go about life has changed. And we're not doing herbs anymore. For hundreds of thousands of years, people ate a forage food diet that was wild plants. We were getting all this stuff. And then after we turned to grains, and about 10,000 years ago, we were still doing medicinal herbs and culinary herbs. And about 100 years ago, we traded all that for drugs.
Yeah. It's such a powerful conversation because so many people call here and say, what test should I take? And, I have a blog on it, and they believe that's the answer because they think there is something that's going to kill it. And I think the biggest takeaway here is that really this is about cellular health and how we can live our lives to make our cells work better. And that's how we address chronic illnesses.
Do the things that matter most. And that's the thing that's happening is everybody is missing the things that matter the very most.
Well, thank you so much for being who you are and a person of commitment and excellence and wanting people to stay healthy. We will have this in our notes, but you can go to rawlsmd.com, RAWLSMD.com to learn more about Dr. Bill Rawls, his work, his books, and of course, his programs.
They do go to rawlsmd.com/resources. They can find out about some of the programs I do and things like that.
Awesome. Well, thank you so much. And what a blessing you are to helping so many people.
Yeah, thank you so much for having me.
Want more insights and solutions? Well, subscribe to our Dysregulation Insider, and it will show up in your inbox every week.